Medicaid pays us about 50 cents on the dollar of cost. I'm not talking about what we charge. To turn on the lights, if we pay $1, we get paid 50 cents. But we have an open door, we don't turn kids away. And so it does create a tremendous financial burden to have a state-of-the-art facility, to have the staff that we do, and to pay. So it is a stretch for us. We help subsidize salaries for faculty. That's why we have a $600 million budget. We've been fortunate that the philanthropic community has been very supportive of this hospital. This building cost $650 million. There's no way the hospital could have built this without support. A third of that cost came from the community. Last year, even in this economy, we had 100,000 donors who contributed $30 million. And that's what allows us then to subsidize a lot of the things that we do.
I was on the staff at the University of Iowa for a while, and in the process became associated with the Department of Pediatrics there. And they had a chronic pediatrics department where I saw 5 to 7 Lawrence Moon-Beetle-Bardet syndromes. They have a collection agency that you probably know that started in 1929 and gathered people from across the entire state of Iowa. This is why it was such an immense institution, because they sent ambulances out all over the state. Now, and they had all of their chronic pediatrics and chronic everything referred to the University of Iowa. You may know that history. Are you making efforts in that? Are you becoming a center for not only the state, but the region for all of these things, or some of these things particularly?
About 10% of our patients come from outside of Colorado. And so we are drawing patients from all over the country. And certainly every county in the state of Colorado sends us children. So we do have a very extensive network for outreach. Having the satellites in the community helps us because it makes it more convenient and accessible to get those children in. Our biggest challenge in seeing all these kids is we keep growing the number of physicians we have, and when we do that, we get more requests to be seen. And so we may go, for example, in gastroenterology, it used to be 2 months to get an appointment into a physician's clinic. We hired more physicians, we got it down to 3 days. About 2 months later, the volume increased so much that we were back out to 2 months. And so we're always playing catch up. So we're always in recruitment mode. Last year we recruited 120 new physicians to this hospital. That doesn't count what's over at the university. And we're always in recruitment mode. But we are putting them out in the community to be more accessible.
What is the total size of your facility campus?
The question is, what is the size of the children's hospital part of the campus? The hospital, the clinics, and our ambulatory pavilion are just under 1.5 million square feet.
Would you comment about the synergy of this facility and the surrounding facilities, the Schmerling Medical Center?
Right.
Just give us a sort of macro overview.
Sure. I mean, right now there are 2 research buildings where we have both pediatric and adult faculty who do research side by side. I was talking about the maternal fetal, which is allowing our physicians to collaborate. When we have children who have a chronic disease that are treated here, when they hit 18, 19 years old, they're no longer children, they become adults. And so we're working very closely to have transitional programs so those kids can continue to be seen, those young adults can continue to be seen in the adult hospital 500 yards away. So, and we've both been on this campus now about 18 months. Children's has been here 18 months. And we're continuing to have conversation about other ways that we can collaborate. We're very new at this.
Have you sold your land down in the center of town? And if so, where will those funds be allocated in your operations budget?
The question is, did we sell the property from the old location, and what would we do with those dollars? I guess we have sold it. We closed a year ago in December. St. Joseph Hospital bought it. They're building a new hospital on that site. Those dollars were used to help offset some of our deficits from indigent care.
I think everybody's very anxious.
Well, thank you. Yeah, you'll see some of this firsthand, so thank you very much for inviting me.
The need for a private room for every patient. So mom and dad are invited to stay. We have all private rooms. What we found out is that parents may want to stay at the hospital, but they don't necessarily want to sleep at the bedside. They want some peace and quiet. So right here, we have the family hospitality suite, and that's what my department funded with the wine auction, and we're getting ready to do another one. And my department is the volunteer patient rep department, and there's 6 private rooms in there. based on their work at Children's, they have the contract for Beijing Children's Hospital, which will look very different from ours. It'll be the large structure because that's what the Chinese culture supports. All the artwork is done by local artists with one exception, and that's Larry Kirkland. He did the glass work, and he's out of Washington, D.C., and that's because nobody in the Denver metro area had that talent. When we moved over from the old hospital, we moved about 400 pieces of art and lost one. That was a real challenge. So let's scoot on down this way.
I think the glass elevators would be.
You like that?
Yeah, I think. Well, the exposed mechanics and everything was just fascinating to the children.
They love it. And that's
Not much. She's just.
we could walk you down the hallways, but because of the H1N1 flu, we can't. Again, all private rooms, and Mom and Dad are invited to stay. They can stay at the bedside. There are kitchen and laundry facilities right behind this desk. And then these are the safe zones for the pets. Again, one. Everybody's taller than I am. It's run by our Childlike Therapeutic Recreation Department, and the patients in there, no procedure, nothing that embarrasses or hurts a child can be done. That's not to say that the patient can't go in there and escape. Medical staff can come in there and get them and take them out, but while they're in there, it's all safe. Now, we divided up our patients according to treatment, not according to age. And on this floor, you have a mix. It's 7th floor is oncology. That's why I have transfusions. 8th floor is general care and health. And 9th floor is chronic cystic fibrosis and cystic fibrosis and depressive disease. So let me take you down, and I think what we'll do is we'll stop on before and I can tell you about the Mother Baby program. Did Jim Schmerling share that with you?
I mentioned it briefly. Yes, you'd had 5 this year or something.
Mm-hmm.
Not that sterile.
Doesn't
But
smell like
he goes,
a
do you
hospital,
have
it smells like
more,
a hospital later.
he goes, do you have more, do you have
They did for a long time, you know, that there used to be a department store called the Denver Drive.
Oh, yeah.
This was their Christmas decoration in the 70s, and right now the patients in the eating disorder program decorated. The head psychiatrist for that area funds this, so it's a really nice project to have it decorated.
So you had it in the other hospital and then you brought it here. Huh. I remember some kid going down to her.
Level 1 is for well babies, and right now we're not in the delivery business. That's going to change. About 50 beds in here. Average weight for a baby is 3 pounds. Smallest baby we've ever had weighed a little bit less than a pound, and the survival rate for a 1 pounder is 90% today. So you've got 1 pounder to growers. What the hospital has done is signed a letter of intent with the University Hospital. So the plan is, and we don't know how it will materialize, is to build a freestanding facility between the 2 facilities, 100 beds. The time frame was before the Denver company was about 2 years. And we'll be delivering babies. Part of this has to do with not separating everybody else in this mortgage. Great hospital, my hospital, choice for
Are the mothers of these, of 8 children and 12 children having babies? Yeah, but it's more dealing with high risk. Yeah, okay.